Hello, everyone. So today we are going to be talking about the disease process and how healing occurs. So just so we can see here how the inflammatory process works. We're going to talk about cell injury, what is a reversible or irreversible cell injury, acute chronic inflammation, and what leads to fibrosis or complete regeneration of the tissues. So one of the things that is very, very important is for us to understand is that the body as a whole is made of cells, different tissues. There is extracellular tissue as well, which is made of collagen and other types of protein, fiber, etc. And the cells of the body, regardless of what tissue they're making, they tend to preserve their environment to try to maintain homeostasis, okay? Homeostasis, hold on, because my cat's playing here. There you go. Homeostasis is a level of status quo, okay, of something like that is normal for that animal or for that person, for that tissue, what is achievable, what can work as far as normalcy goes with minimum expenditure of energy. So that's what homeostasis is. It is this balance that exists, okay? Physiologic stress or pathologic stimuli, when those two things happen, and I'm going to explain here what happens, is the cells are going to undergo what we call adaptation to try to find a new steady state, to try to still preserve viability. So cells don't really love to die. They will try to adapt first before they actually, to try to preserve viability. And if those things that they're trying to adapt are going to exceed their capabilities, that's when injury is going to happen. So what is physiologic stress? So physiologic stress is the following. So you are this person, let's take me. I'm this person and I do little exercise, maybe I'll walk here and there every once in a while, okay? And then one day I decide that I am going to start working out. So then I can go and start, instead of walking, I start jogging. Okay, one day, next day I jog again, and you are going to notice that once you start working out, everybody has noticed this, the body starts to hurt. The body goes into this inflammatory response, but the cells are not going to die. They may be inflamed, but as you continue to do this, the cells are going to adapt, and this is now what you can do. So that's the importance of, once you start to work out, you start with like 5-pound dumbbells as opposed to 100 pounds, because if you just 5 pounds, your cells, even though they're not used to doing that, they can do this without dying and to try to slowly adapt. If you go ahead and do the 100-pound dumbbell, because your cells are not even adapt, they didn't get a chance to adapt doing what we call hypertrophy, which we're going to explain here in a second, they are just going to go straight to injury. Okay, so that, and then when there is injury, the cells are going to die. And that's the difference. So that's physiologic stress, and then pathologic stimuli. So when you have some sort of disease, an infectious disease that hasn't totally killed the cell, but the cells are trying to, for example, pathologic stimuli. So drinking, okay, alcohol in the liver. It causes inflammation in the liver, but the liver tries to recuperate without dying first, okay? So that's another idea of pathologic stimuli. And the cells are going to then adapt, okay, based on the new normal for that particular individual to try to preserve what we call viability, okay? So there is different ways that cells are going to adapt. So number one is atrophy. Atrophy, I need you guys to write these things down, because atrophy is a decrease in cell size, okay? So the cell used to be this big, now it's much smaller, okay? So a decrease in cell size. So for example, and I love to compare with atrophy, I like to give the example of Arnold Schwarzenegger. Arnold Schwarzenegger, when he came to the world from Austria, I think he's from Austria, with Conan the Barbarian, I think it's 1982, something like that, in the 80s. So you guys were not even thinking about being born. When he came, so he was this bodybuilding and he was huge, very muscular. But so his cells, okay, his muscle cells were hypertrophy. Hypertrophy is an increase in cell size, okay? But a hypertrophied cell needs a lot of energy to be maintained, a lot of exercise and a lot of energy in form of nutrition to be maintained, okay? So once you stop utilizing the cells to the max of their ability, they're going to not decrease in the number of cells, they're just going to decrease in size, because a smaller cell has less demands than a bigger cell. So, and that's why if you Google Arnold Schwarzenegger, Conan the Barbarian, and then you can see him when he was a bodybuilding, and then you can Google him on the beach on today's age, you are going to notice a difference, because this is this very what atrophy looks like. Now, a lot of the times also because of malnutrition, the cells need to atrophy themselves because you're not providing a lot of nutrition. So the cells cannot perform and cannot maintain their original size. So they have to atrophy first before they actually die, which is then injury. Okay, so the first adaptation is to atrophy, and that's when you see people or horses that have been malnourished and have starved. Their muscles are they're small. So it's not, the body hasn't eaten up the muscles yet. They're small, okay, small in size. And then as you start to refeed these animals, they start to gain weight again, and the muscles and the cells grow up again to the size that is the normal size. So that's what atrophy is. So decrease in cell size. And then we have hypertrophy, which is an increase in cell size. So hypertrophy, it's still a way to adapt. So like I said, given the example that I'm now going to start running or jogging or whatnot, or just doing the dumbbells, cells that were like this size, then all of a sudden they increase in size and become bigger, and that's hypertrophy, okay? Hyperplasia is an increase in cell number. And that's, again, an adaptation. So that happens in the pregnant uterus. So the uterus is one size, and not only does it increase in size, but also increase in cell numbers. And also the mammary gland of a pregnant male or pregnant woman or any kind of mammal that's pregnant, because you have a number of tissue for the mammary gland. And as you're trying to produce more milk, you are going to increase the number of those cells. And then we have metaplasia, and I'm so sorry, my cat is playing here nonstop. They're kittens. And then we have metaplasia. And metaplasia is a change in cell type, okay? So a change in cell type to try to preserve. And metaplasia, the best example that I have is cells of the respiratory system. We have these cells. I don't know why this thing does this. We have this. We have these cells that are ciliated cells, okay? If you guys remember the mucociliary system that I talked about in the immune system. So the mucus is going to trap these particles, and then the cilia are going to sweep these particles up, okay? So in the mucociliary system, if they're working well, this is how it happens. And that's how when we go outside and it's super dusty, we're going to have like dusty snot coming out of our nose. Hold on, I am going to make this cat stop. Hold on just a second. Okay, I think I have been able to make her stop. My ADD goes crazy if I have a cat doing what she was doing, which I put boxes there for her to play, and now she can't play. So the mucociliary system, she started again. Dear Lord, hold on just a second again. Okay, I kicked the kittens outside. Okay, so the mucociliary system again, so they're formed of these cells. And when they're working well, they trap, the mucus is going to trap particles. Not all particles, sometimes viruses, if they're smaller than a certain size, they go through, and that's how we get influenza, for example. And then the cilia are going to sweep those particles out the nose, okay? Now, cigarette, so smoking. So as you all know, cigarettes have toxins and they kill the cells. So the body starts, instead of just killing the cells because it's toxic to the cells, what the body does is in a way to adapt before you actually get more serious side effects, is what we call metaplasia. So metaplasia is the body is going to start to add, instead of this ciliated cells, they just add cuboid, what we call cuboid cells, into this area, which are they're tougher cells. So the toxins from the cigarette smoking are not going to kill the cells, but they don't have the cilia. So they don't work the exact same. So metaplasia is a change in cell type. So they don't work the exact same. They are a cell, the person is alive, it's not cancer yet, but it doesn't work the same. And that's why people that smoke and have smoked for a long time, they actually, if you guys know, they go at all times, or cough, 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 because all this phlegm that has been accumulated, they don't have the cilia to actually help remove from the system. So they actually have to physically do that because they don't have the mucociliary system to help them, okay, remove that. And then when the adaptive capability is exceeded, that's when injury is going to develop. So that's the example that I gave of, you do 5 pounds, you can do that. But if you just go ahead and do the 100 pounds, you can work yourself up to 100 pounds. And even then you can have injury. But if you don't work yourself up to the 100 pounds, you are definitely going to cause injury. But when you do something that is more, so when the adaptive capability is exceeded, so you malnourish, atrophy, until the point that the animal dies. Same goes for hypertrophy. Increase in size, and then you're gonna have like a tear in the muscle, okay? And that's how injury is going to happen. Now, injury can be reversible, but with persistent or severe stress, injury is irreversible and it's going to lead to cell death. So injury can be reversible if it's mild and doesn't last very long. So just as an example for injury that can be reversible. So when you drink alcohol, it is toxic to the liver and it causes a little bit of inflammation in the liver every night, but the liver is able to remove the toxins, metabolize, and move on with life. Now, with persistent stress, so what is that? What would that mean? That would be a person that is alcoholic. So they drink every day a certain number of ounces or alcoholic amounts and for long periods of time. And that the liver is going to exceed the capability to continue to reverse the injury and is going to start depositing fiber in the liver. And that is what we call cirrhosis of the liver. So the liver, the organ, even though it doesn't work well, it's still there. It's smaller, it's fibrous. It doesn't have the same capabilities as normal hepatocytes because it's just fibrotic. It's a mass of fiber that's still in there. But that is persistent injury for long periods of time. Now that liver has no use because it doesn't have normal hepatocytes. And then for an injury that is severe enough, so that one is persistent. For an injury that's severe enough is what happens when people do what? Binge drink. So in one night, they drink too much and the liver actually dies and the person dies, okay? So that is the 2 examples of persistent for long periods of time, stress, or one that's very severe stress that is going to cause irreversible injury and lead to cell death. This photo here is the photo of the heart, okay? So these are slices of heart. Obviously, this heart is dead, right? Otherwise, it wouldn't be here. But this here is the photo of a normal heart. We have here the left ventricle, the right ventricle. Why does this do this? The right ventricle. And the left ventricle, as you guys can see, is much thicker in the diameter of the muscle, the myocardium. And that is because the left ventricle is going to send blood to the rest of the body. Through the aorta, it goes to the rest of the body. And the right ventricle is going to send blood just to the lungs via the pulmonary artery. Okay, so that's why, so it doesn't have to be as strong. But as you guys can see, the left side is much stronger than the right side because it has to overcome more work, which is to pump blood all the way through the entire body, as opposed to like, here's the heart, here's the lungs, or just to pump blood to the lungs. Okay, then we have here, so this is normal myocyte. Then we have here a heart that is hypertrophy. Okay, so this is adaptation, adapted myocyte. You can see how it's thicker, bigger than the normal myocyte. And this is a heart that has hypertrophied. What is one of the reasons that a heart is going to hypertrophy is because, for example, a person that has high blood pressure, so instead of a normal blood pressure, blood pressure is the arteries have a diameter and they're made of muscular, and blood pressure is the amount of force that the heart needs to beat to pump blood through the arteries, okay, and maintain this blood going in a circulatory way through the body. So a normal blood pressure, okay, 120/80 is normal. The body continues to, and the heart continues to pump this way here. If a person has high blood pressure, that means that all these arteries are more tight. They have more resistance. So that means that this heart needs to beat with much more force than a normal heart to be able to accomplish the same amount of pumping of the blood throughout the body. So because everything is so tight, all the arteries, this heart needs to pump with much more force. And this is what happens right here. We have hypertrophy. Now it has these little white things going on. We have this hypertrophy, and then as you guys can see, you see here the amount of blood that can fit in one ventricle as opposed to the other one. So do you guys think that this ventricle here can pump the exact same amount that this normal ventricle can? Because the answer is no. And that's why people that have, say, high blood pressure, so this person here can goes jogging, and even if it exceeds a little bit, they may have a little bit of a heart pain or pain in the lungs or whatnot, spleen. But this guy here, if the level of exercise, for example, exceeds the amount of blood that this heart can actually pump out, the first one to suffer is going to be the heart, because if you guys remember from anatomy, from the left ventricle, the blood goes to the aorta, and the first bifurcation of the aorta is already the coronary vein. There's a cephalic and the coronary artery, and the coronary artery comes and provides blood and nutrition and oxygen to the heart. So if there is something that this person here with high blood pressure exceeds the exercise, I'm going to go for a jog, there's going to be, the heart's going to try to beat to try to maintain oxygenation. But what happens is it's going to fail. And when it fails, this is what is going to happen. So this is now what we call an infarction, okay, cell death. So it may start with just a little bit of hypoxia, okay, or like ischemia. So it can be reversible if that tissue hasn't died yet. It can just be a little ischemia, so a little less blood flow to that area. But too much ischemia is going to lead to cell death. And once this part of the heart is dead, the heart cannot beat normally, and then the heart is what we call cardiac arrest or infarction, which is the cell death of the heart. Okay. Cell death. There is two ways that a cell can die. Number one is programmed cell death, which is called apoptosis. Programmed cell death happens every day, all the time of our lives. It's these dead cells are removed from the body. They go to the spleen, they go to the liver, they get recycled. So for example, red blood cells, they last about 120 days. At the end of their life, they get recycled again. All the hemoglobin, the iron gets reutilized, and then new cells are being formed all the time. And that's called apoptosis. Apoptosis is programmed cell death. There is no inflammation that happens. There is no disruption to the tissue whatsoever, okay? But different cells have a different lifespan, okay? And then necrosis is when the cell dies because of some sort of inflammatory problem. So loss of blood supply or exposure to toxins. We're going to have cell swelling, protein denaturation, and we're going to have, and this is going to lead to inflammation, tissue dysfunction, etc. So cell death that is programmed and physiologic everyday happening. Apoptosis. Necrosis is when, for example, this guy here is necrosated, okay? And that's cell death that wasn't supposed to happen due to ischemia, which is loss of blood supply or exposure to toxins, etc. Okay, so that is ways that cells can die. Now, what are some of the ways? So some causes of cell injury. Some causes of cell injury is going to be number one, oxygen deprivation. So we just talked here about the heart. So oxygen deprivation called hypoxia. Hypoxia means low oxygen. There's three ways that we can have oxygen hypoxia in the tissue. Number one, from ischemia. Ischemia is loss of blood supply to the tissue, okay? Because of impeded arterial flow or reduced venous drainage. So here's the tissue. Here is arteries arriving and veins leaving. If you have a blockage here, for example, atherosclerosis, which is this plaques of fat inside the artery, so now the blood cannot arrive to this tissue, so we have tissue death via ischemia, okay? Or if we have a blockage here, which is the venous return, so more blood arrives, but cannot continue to pass. So this, it gets like a, this area also dies because less blood can arrive at that point because it becomes engorged, okay? The other way that hypoxia can happen is from inadequate oxygenation. Inadequate oxygenation is your blood may be okay, but you are not, your lungs are not working well via pneumonia or emphysema of the lungs. So because the lungs are not being able to receive enough oxygen to then do the gas exchange in the lungs, in the pulmonary tissue, then you're going to have inadequate oxygenation. And then the other way that we can have hypoxia is because of a reduced oxygen carrying capacity of the blood, which is called anemia. So your lungs are working well, receiving oxygen, but the gas exchange becomes a problem because you don't have enough red blood cells to be able to carry oxygen. So hypoxia is the number one reason for cell injury, and it can be, again, it can be reversible depending on the amount of time or severity, okay? It can be reversible or irreversible, okay? Chemical agents. So any chemical substance can cause cell injury, even salt, water, anything is a toxin. I think you guys need to understand that everything can be toxic to the body. The only thing that determines if something is a toxin or, for example, a medication is the dose. The dose is what is going to be what causes something to become a toxin or not. So I don't know if you guys remember, you probably don't because that was many years ago, but there was a campaign one time in a radio station, and whoever could drink more water without peeing. And this woman drank water, didn't pee. And then the water, what happened? You can drink water, but you need to actually urinate. And too much water caused brain swelling, and then she died because of drinking too much water. So everything needs to be done in balance, guys. Don't do anything in excess, okay? So anything can work as a chemical agent. So salt, okay, so if you add salt to something, it can burn. Oxygen, too much oxygen can also burn. So for example, we breathe oxygen, but the air is made up of 70% nitrogen. Why? Because if we just have everything 100% oxygen, it can also become toxic to us, okay? Obviously, ethanol, which I already explained about chronic ethanol abuse and irreversible liver injury, and also binge drinking, which is excess ethanol abuse in one setting. Infectious agents can also cause cell injury and cell death, viruses, bacteria, etc. Genetic defects. So, you know, certain genetic defects, so people with cystic fibrosis, so their cells are not normal, they're not capable of not having pathologies, okay? Other causes of cell injury, immunologic reactions, okay, such as high allergy or autoimmune diseases, or for example, anaphylactic shock, which is a dysregulated allergic reaction, and exaggerated immune response to an allergen, okay? So that can actually lead to cell death, and it can actually lead to death itself. Autoimmune disease, which is a loss of self-tolerance. So we talked about a little bit, but rheumatoid arthritis, lupus, celiac disease, these are all autoimmune disorders where the body starts to attack its own self. Nutritional imbalances, malnourishment, obesity, you guys, it goes without saying. Physical trauma, cuts, bruises, burns, cold, all this physical trauma. So a little bit, you know, can lead to just a little bruise, but like blunt trauma can just like bruise a little bit and can be reversible. But if it's too much, it can actually lead to cell death in the area. And aging, so repeated trauma, imperfect restoration of the tissue, what we call cellular senescence. So the cells are just becoming older and older, which means they're not being capable of regenerating as well as they should, okay? So this is going to be cause, if we didn't have aging and cell senescence, people would be living to thousands of years, because some people just die because the body gave up, because even if they're healthy, because it's just too old, okay? So reversible or irreversible. So again, so response to the injurious stimuli is going to depend on the type of injury, the duration, and the severity. Okay, so when I say type of injury, it's one thing to have a cut, okay? To have a cut, you can actually go ahead and suture it and try the best, and the body can heal even though a few cells will die. And the other thing is type of injury, to have something cut off. If you cut off the arm, if you cut off the finger, there's going to be very difficult, you know, some people have reattached, but it's difficult, okay? That's type of injury. A cut can be too much, too severe. And like I said before, the duration or the severity of the injury. And the consequences of this injury is going to depend also on the type of the injured cell. So what is being made of? So for example, striated skeletal muscle can accommodate, so striated skeletal muscle, muscles of the body, of locomotion, for example, can accommodate 2 to 3 hours of complete ischemia without irreversible injury. So that's why when people get like a bite of a snake bite or a spider bite, you can actually do a tourniquet in that muscle, in that limb, and this striated skeletal muscles can withstand 2 to 3 hours without dying, okay? As opposed to the cardiac muscle, can only withstand about 20 to 30 minutes of no oxygenation. That's how you can resuscitate a person, even if they have been, if their heart has stopped beating for the last 20 minutes, you can resuscitate a person. However, the brain can only tolerate about 4 to 5 minutes of complete oxygen deprivation, which means even if the person resuscitates after 10-15 minutes, it's going to be unlikely that the brain is going to function normally. Okay, so depending on the cell type that we're talking about, that's how injury is going to be reversible, irreversible, how much that particular tissue is going to be able to withstand, etc. So the next class, the next module is going to deal with inflammation. We're going to talk about acute inflammation and chronic inflammation. So as always, don't hesitate to contact me if you have any questions.